When it comes to drugs for Parkinson's disease, probably one of the most common types of drugs is a dopamine agonist. And of course, remember, agonist means when the medication is available to the receptors, it either acts like that particular neuroreceptor, or it produces effects like the receptors would produce. So if you want to look on page 162, you'll see the dopamine agonists, and our prototype, the most common drug you'll see, is a drug called Sinemet, and that's made up of two chemicals. There's carbidopa and levodopa, and both of those are precursors to dopamine that have been produced synthetically. So they work on the receptors to increase dopamine levels in the brain. Now, levodopa or L-Dopa is a synthetic dopamine, but they haven't figured out a way for it to totally cross the blood-brain barrier. So the brain can't really use it completely. If we could just replace the dopamine, then we wouldn't have Parkinson's. But whatever L-Dopa is able to get to the brain is taken up and used very rapidly. So what they do is they add carbidopa, and that enhances the action of the levodopa, and that way you can use less drug. It lasts a little bit longer in the brain with the carbidopa, and you don't have to use as much, so you don't have the side effects. So the Sinemet helps reduce muscle tremors and the rigidity that is seen with Parkinson's disease, and it improves the person's just overall coordination and allows them to be more mobile. The side effects and adverse reactions you're going to see with Sinemet and the other dopamine agonists is postural hypotension. So the person will change positions, and sometimes that will cause the blood pressure to drop. So it can also cause just general hypotension too if the person has a higher blood pressure. So in addition to the falls risks that the patient already has just because of their impaired mobility, they're also going to have falls risk because of the hypotension. They can have headaches. It can cause a lot of problems with their GI tract, abdominal pain and nausea, and vomiting. They tend to cause them to have weird dreams, and it might cause them to have difficulty sleeping at all. One problem that has come up that was kind of unexpected, because dopamine controls the pleasure centers of the brain, dopamine is involved in addiction. And so sometimes people who are on dopamine replacement will have trouble controlling impulses to do things that they would not otherwise do. One thing that was noticed was that if a person on dopamine agonist began to gamble, sometimes they would be unable to stop. And I know was at least one case of a lawsuit where a family member was suing the drug company because a person was on a dopamine replacement and took up gambling as a hobby and gambled a huge amount of money away, something that this person would never have otherwise done, and they blamed it on the medication. There can also be added confusion in addition to the other central nervous system problems like hallucinations and unusual behaviors. The person can get very confused. So this is not a fix-everything drug. It relieves some of the coordination and mobility problems, but it can also cause problems of its own. So combining Sinemet with other dopamine agonists can cause very severe hypotension, and combining with an MAO inhibitor that a person might be taking for depression can cause a hypertensive crisis. MAO inhibitors, when combined with certain substances, can cause a huge rise in blood pressure, and that can be dangerous. And people have actually had strokes. So you have to be really careful about what meds these dopamine agonists are combined with. On page 164, you see a lot of patient and family teaching, and it's important to read over those and be familiar. Sinemet has a lot of dosages, and it can take trial and error to figure out what might work best with a particular patient. You want to give with a lot of water and give a half hour to an hour before meals. These should be taken on an empty stomach. So if the person takes it in the morning, maybe give it at 7 a.m. and then the person would have breakfast at 7:30 or 8. Of course, watch for postural hypotension. Tell the person to adjust their position slowly. If they're lying down, sit up slowly and sit on the edge of the bed. If they were sitting, have them stand up and hold on to something before they take off, because of the they can get that head rush and fall. Watch for behavioral changes and delusions. You want to monitor the person for what they call dyskinesias, which is involuntary muscle movements. That's where you'll see sometimes the head shake and the hands move. And people with Parkinson's will sometimes display what's known as pill rolling. So they'll kind of rub their fingers against each other as if they were rolling pills between their fingertips. If you see changes in muscle movements, it's important to hold the med and consult the healthcare provider. They might be getting too much. An early sign of a need for dosage changes is what they call blepharospasm, which is eyelids twitching. Sometimes the first thing that you'll see is the eyelids will begin to shake and twitch a little bit, and that could indicate that they're not doing so well on that particular dosage and they might need a break. So you'd hold the med and call the healthcare provider. We have a couple of other meds that are usually not given alone necessarily, but are given in conjunction with the dopamine agonists like Sinemet, and they help keep them in the system longer. So one category of drug is known as the catechol O-methyltransferase inhibitors, or COMT. When you see methyltransferase, it ends in ASE, and usually substances in the body that end with ASE are enzymes. We know that they cause enzyme action. So catechol O-methyltransferase is an enzyme that breaks down or metabolizes your neurotransmitters like dopamine. We have all these neurotransmitters and they have a very important job, but they can't just go loose in the brain and do whatever they want to do. We have to have other control factors to break them down. And if a person has normally functioning neurotransmitters, that COMT is just part of it, breaking down neurotransmitters and returning them to be metabolized so that more neurotransmitters can develop. But when you have a person with Parkinson's, they're breaking down too much dopamine, so you want to inhibit the breakdown. You're inhibiting the enzyme and allow the Parkinson's drugs to remain in the system a little bit longer.